Hello everyone and welcome to another Female Friday where you can't be what you can't see. Today I'm kind of getting the impression that we're about to interview some RA royalty. So I would like to introduce one of our foremothers, Eleni Moka. How are you doing today, Eleni?
I'm doing fine, Becky. What about you?
Yeah, we're good. So we're going to get on with the questions. The first question is, what's your name? Where are you from originally? And where are you currently working?
Well, my name is Eleni Moka. I come from Greece. I was born in Athens and did my medical school in Thessaloniki and continued my specialty in Athens, in the university hospital. And the last 20 years, I work as a consultant anesthetist in Crete.
And what attracted you to the field of regional anesthesia?
Well, I have to say that I was exposed to regional anesthesia very soon in the beginning of my specialty, and I have to admit I was quite impressed. It was love at first sight, maybe, because it was extremely impressive to see a patient being operated on upper or lower extremity without being asleep. And for
Yeah.
me, this sounded fantastic at the beginning of my career. And of course, step by step, many things made it me to love regional anesthesia because it contributes a lot to acute perioperative management, having comfort for our patients, having them communicating throughout the process they're undergoing, and so on.
Perfect. It's quite addictive, isn't it? Regional. You kind of dabble at the beginning and then you end up in places you never thought you were going to be. So, what would you do if you weren't an anaesthetist? What other things might you consider doing with your life?
Well, I think I should still be a doctor, but maybe being more involved in humanitarian activities and in initiatives, uh, initiatives protecting human rights or focusing on inclusivity, equity in health and healthcare and so on. But still, I think I would be involved in medicine by some way, even if I would not be an anesthesiologist.
So, what's your favourite part of your job?
My favorite part of the job is the daily practice, the daily clinical practice, being part of the perioperative care team, which is very important for me, and contributing from my side and from my actions to the better outcome, to the optimal outcome of our patients. I mean, with the regional anesthesia techniques, we know very well it's not only the ethical part of relieving pain, but we definitely and absolutely contribute to uh, an optimized recovery of our patients and an enhanced recovery and the fastest return to normal life. And I really like this. Plus the
Yeah.
team spirit and the teamwork inside the operating room.
Okay. And since you're a passionate regional anaesthetist, I guess you have a favourite block. But if you don't have a favourite block, you can tell us your favourite dinosaur.
Well, this is tricky, I would say. For dinosaurs, I know nothing. As far
Okay.
as the blocks, well, at the beginning of my career, my favorites were the central blocks, of course, back at those years, because let's not forget, I started my specialty in 1998,
Wow.
and the blocks were at their beginning that time. But if you ask me for a peripheral block, I would say auxiliary, because it's the
Okay.
first one I learned, and I think every regional anesthesiologist should know it. It's not such a difficult block. It's not so difficult to master it. And it can be really, really helpful in our daily practice. It needs
Yes.
precision, of course. Through my career, I went through all the steps of mastering this technique. I learned it with paresthesia, then with nerve stimulation, and of course, later on with the ultrasound
Wow. So I'm guessing
utilization.
at the beginning you did like arterial transection for your axillary
Exactly.
blocks.
Exactly. And my first chief in the department where I started my specialty was saying, well, you can do it transarterially or Even if you give a volume of local anesthetic, in the majority of situations, it will be effective. Because back in those years, we didn't have the neuro stimulation. It came a couple of years after in our hospital, back at the beginning, let's say, of 2000.
Wow, that is absolutely incredible. I cannot, as the ultrasound generation, even imagine what it would be like to put blocks in without an ultrasound. Like, the whole idea just seems a bit scary. Right, Eleni, we're going to move on to your
Yeah,
1 minute block break now. These are several questions completely unrelated to anaesthesia, so we can get to know you a little bit better. I have my timer. Are you ready?
yes, of course.
So, first question. Name something that you think you're really bad at.
Sports, I'm not good at all.
Okay, and what animal best represents you?
Lion,
Okay, Braveheart.
I think
If you
lion,
could travel anywhere in the world, cost and time aside, where might you go?
Chile and Patagonia
Oh, that would be
for a second.
nice. Are you a couch potato or a gym bunny?
Couch potato, I would say.
That's all right some days. And beach hut or cabin in the woods?
Beach, of course.
Okay. Coffee or tea?
Coffee.
Coffee. Early bird or night owl?
Sorry, repeat, I lost you.
Okay. And what's the most used emoji on your phone?
The one with a smile.
Yeah, I think that's everybody's, isn't it? Back to the serious questions. So, I'd like to hear a little bit about your career path, how you've gone from medical school to now president of ESRA. What's been happening in all this time? How's this been pulled off? How have you managed it?
Well, it's not such a tremendous story. Things happened step by step. I finished medical school. I did my 1 year service in a rural hospital as it was by the regulations back at those years. Then I decided very carefully the specialty because I have to admit I went to a course of ALS and BLS and so on, and there was the opportunity to enter the operating room to learn intubation, and I said, oops, this is the specialty I want to do. And I started for a couple of months in a small hospital until my position opened in the University of Athens, in the University Hospital. I was very soon involved in regional anesthesia back at those times because the professors and the consultants we had in the group as our supervisors were already involved in ESRA. In fact, Athina Vadaluka, who was one of my mentors, is one of my mentors, was back at those years the president of ESRA as well. The hospital was initially focused on obstetrics and all the techniques we have to do from regional anesthesia to support labor, working labor, epidurals, and so on. And also I had the privilege to be taught by anesthetists that could master block for general surgery or vascular surgery and so on. By this way, after I graduated the specialty, I soon entered the Greek section of ESRA Greece, the zone of Greece and Cyprus as a council beginning, and then I applied for a board position, then for treasurer, and then you know the rest of the story, how it happened. It has been a super wonderful journey for me. I feel that my entrance in the ESRA family, I would say, fully changed my life. Huh? It was a striking point, I would say.
Yeah. And am I right in thinking that you're going to be the second Greek lady to be president of ESRA?
First is Athina Vadaluka, my mentor, during my full professional career. From
Yeah.
the moment I started to learn how to hold the needles until now. who of course, except the mentor, became my friend in the course of time.
Yeah.
She was the first woman ESRA president from Greece, and I'm the second, yes. And
Wow.
I feel very honored, privileged, first of all, to be elected and selected, and to be surrounded by so wonderful people, because ESRA has the spirit of family. It's true, and you know that.
Yes, I have my Ezra family that look after me, but it just seems absolutely incredible that we've had two female presidents and they've both come from Greece. There must be something in the water, some regional anesthetic
Well,
sparkle
it's not
over
the
in
water,
Greece.
the spirit that has been forwarded from one person to the other. And I have to admit that the specialty in my country is female dominated. It's not male dominated. You will see more women anesthetists in Greece than men. Now it
Okay.
seems to start a little bit, but in the past it was 75% women and 25% men.
Wow. That's really incredible because in the UK, we're currently at about 38% women and it's probably on the decline. So clearly the ladies are rocking
Really?
it in Greece. So what do you think is your biggest career achievement? Is it going to be president of ESRA, or have you got something else that you've been doing that we need to hear about?
Of course, being involved in ESRA is an important, a very important achievement, certainly. But the first thing that would come to my mind is not only that, is the results of collaborative efforts with all the people in ESRA Greece, in the Greek anesthesia community that have led to the dissemination of regional anesthesia techniques in many, many hospitals. Imagine that 15 years ago in a hospital there wasn't an ultrasound machine in the operating room, and now in every hospital we have the machines because we did a lot of workshops, a lot of training with the support of people of ESRA or other colleagues from abroad. And now you see that the trainees are asking about it. This expansion of regional anesthesia, I think it's very important, and I think I have a significant part in that as well. And the
Yes.
second, the more sentimental, is a big achievement for me was the Congress last year, last June in Thessaloniki.
Where we all just melted. I'm never going to forget how hot
Mm.
it was. But for someone who's
Well,
Greek,
the
it
only thing
probably
you cannot,
wasn't that hot. It was hot.
well, it was a little bit strange last June. It was early when the hot weather came, and it's the only thing you cannot control when you organize things. I mean, it's something that we have to accept sometimes.
Yes, yes, and just have memories of sweating profusely. Do you think you've had any particular career struggles?
Well, I will tell you, I cannot say that I had struggles. If you ask me as a female,
Mm-hmm.
never felt excluded or something. But I have to admit that in my country, the surgical teams are male dominated. And at the beginning, maybe 15 years ago, it was quite difficult to persuade them on the benefits of some regional anesthesia techniques. Why you should do a block, for example.
Yeah.
They were a little bit reluctant to accept at the beginning that our techniques can influence the outcome. This was quite difficult to persuade them at the beginning. In the course of time, of course, now there's no discussion. They come and say, I need a block. So it's successful, I think, at the end. But it was difficult with some, tough moments, some fights. Why don't you put an LMA to finish? It's faster because, at the beginning, we needed more time to master
Mm-hmm.
the techniques themselves, and we were not so fast as we are currently, as it happens everywhere, I suppose.
Yeah, I think it's universal that you need to develop that trust between your surgeons when you say, look, I'll just do this and it'll be good for the patients. It takes building up that relationship, doesn't it? That they think, yeah, she knows what she's talking about, maybe. What's the best piece of career advice you've ever been given?
To follow my dreams and never stop dreaming, to pursue my beliefs, and to be inspired by people that uh, are also in the same page, let's say, as far as the beliefs and the dreams.
That's great advice. And what specific advice would you give to women who are coming up behind you in the field of RA?
Well, again, the same, first of all, pursue your beliefs, your dreams, be inspired by your thoughts, never give up. There is always a chance for succeeding, but even if there is no success and you consider it a failure, it's only temporary. And every failure, have it in your brain, in your mind, not as a failure itself, as an opportunity to
Yeah.
acquire experience, to become
Yes.
better, to correct things, never be disappointed. We have disappointments in our lives, and this should last for a short period of time. I'm quite positive in thoughts. I'm an optimistic person. So I would say see everything in an optimistic way, the good and the bad things.
Okay, and finally, Eleni, tell us something about yourself that we may not know.
Okay. I will tell you something that is related to the job, to the question regarding the job that you asked me that I would might do. My first wish was to become a painter.
Okay.
But of course, back at those years, it was not so easy in my country at least. So my parents said, look, if you want to survive, you need to go to a university, select a university. But I have not left it. And in my free time, I do some painting. Yes. I
We
like
have
art a
lots
lot.
of painters. So we have Barbara Vershek, she's a painter. And actually, I'm blown away by the amount of creativity amongst RA women. We have a lot of Amdram people, painters, potters. It's just incredible, really. They are quite amazing women. So you're the second painter. We'll have to get like a little group going.
My dream is when I have some time to go to an adult school for painting because what I have done up to now is without receiving any lessons or courses, just coming spontaneously.
It's
And
all
I have
time, isn't it? You need time to do these things. And I
that
imagine
you
you
need
are
to,
a very busy lady.
yes, I have to admit the last 8 years I have not touched anything, but it's my dream to go back again.
It will happen if you want it to. Eleni, you have been absolutely wonderful. Thank you for coming and talking to us. As I said, I feel
You
like
have
it's
been
like you're my
lovely.
RA foremother, that you're doing it for all the ladies so that the other ladies can come up behind you and look after other ladies behind them. And I think this is how this is going to work, isn't it? If we're going
Of
to
course,
encourage
I need
women
to
into regional.
congratulate I need to congratulate you on your initiative. It's a really, really, really wonderful, fantastic initiative to
Thank you
promote
very
women in
much.
this
It's much
way.
appreciated, and I'd say it was all planned, but I've winged most of it. I think, as you say, as things come up, you just organically see where things go, and then you have a couple of good ideas, and they kind of go well, and then you suddenly find yourself with a YouTube channel. Who can plan it? Well,
Congratulations. Big hug.
thank you, Lainey, and lots of love to you in Greece. I will speak to you later.
Thank you. Bye bye. Bye bye.
Bye.